Howdy y'all, welcome to In the Know with Lady Contessa. Real talk, real life, real perspective. I saw this video on YouTube where Dr. Frieda talked about angioedema. She showed pictures of a few people who had angioedema. And it was caused by various blood pressure medications, ACE inhibitors, such as lisinopril, benazepril, and ramipril. Those are ACE inhibitors, blood pressure medication. And these people's lips were big. The swelling was so big that it seemed as though you can just pop it with a pen, because it was so big. Anywho, this angioedema involves swelling of the lips, the tongue, your throat, even your nose. And we're not talking about the outside skin. We are talking about the inside, okay, though, the inside of your nose, the inside of your lips. But of course, the outer is going to be really, really big. And of course, with your throat starts closing, it can be fatal. Okay, though, it can be really fatal. So she was talking about those three particular blood pressure medication. Now listen, from my understanding, those three particular blood pressure medication really isn't, well, for black people, I'm going to put it like that. It can be hard on black people because you're looking at the genetic differences that goes into making various medication, and especially in making medication from these three pills. So when they do clinical trials, of course, more Caucasians, at least for some clinical trial, more Caucasian, very few blacks. And again, the study in genetic differences may not be vast, but the FDA or whomever approve of those medications, go ahead and approve it because they don't have the full understanding of that medication. So black people will experience more of that allergic reactions that can be fatal. So why do doctors prescribe that? Well, it's more like a default kind of thing. Not everybody are taking those ACE inhibitors because there are some alternate blood pressure medication that you can take. So if your doctor is prescribing, those particular medication to you, you need to ask him, does he know? Well, they may not take kindly to being questioning. But, just tell your doctor you don't want to take those particular kinds of blood pressure medication. You may not experience it right then. Now, I was reading some of the comments, and a lot of people had those particular issues. Their parents had those issues. Some people died with it. Some people died with that. Angioedema, they died with that from taking those particular blood pressure medication, ACE inhibitors. But as I was getting ready to say, is that sometimes you can not experience it at the beginning. You can be taking it for 5 or 10 years, and all of a sudden, after that length of time and taking it, you can start experiencing that particular reaction where your lips are swelling gaga big, your tongue, your throat may be closing up and end up preventing you from breathing and all of that kind of stuff. But if it happened to you, get yourself to the emergency room. Now, again, just because you have been taking it for so long doesn't mean that it won't ever happen to you. Just be aware that those particular blood pressure medication called ACE inhibitors can cause angioedema, swelling of your mucous membranes. But that was interesting. Wow. If you're taking, once again, lisinopril, benazepril, and ramipril, if you're taking that, just be mindful that, and especially if you are a black person, just be mindful for it, because there is various research that goes into putting together the various medication. And a lot of black people may not be in that trial. Who knows? We got, again, genetic differences as races, and it may not be for everybody. That's all I'm saying. Okay, dope. Well, with that being said, thanks to Trill for lending me your ears. I am Lady Contessa, and I am going to plant you now and dig you later. And don't forget to come back now, you hear? Ta-ta.